You mentioned these different data sources, and now we know yesterday the university announced the Research Data Commons, and Vice President Fred Kate described it as the Research Data Commons at IU will ensure contributions to open and transparent science and scholarly creativity at IU. My understanding is you're a lead on the task force that created the data commons, right? And making data available for researchers. So I guess this is a little pivot from what happened with COVID, but maybe being able to do this on a different level and more consistently across IU. Could you talk about the data commons? And I think we'll have some questions about that as well then.
Great, thank you. I really want to take this opportunity to think about how university infrastructure can be created that enhances, doesn't duplicate, but essentially is connecting the dots. So I think of infrastructure building as first finding out what do we have, what do we need, and where are the gaps, and how can they be filled in a very, sort of, if we're going to invest, let's do it in a way that doesn't put burdens on different places and people can all use it. So the Indiana University Research Data Commons initiative is something that has resulted from many, many people being involved in conversations saying it would be great if, and this is happening in universities throughout, this is not just special to IU, what's the infrastructure that's out there to help take advantage of research data into our scholarly profile, into what we do? What can make it better? And so we know that different universities, we already think right away, oh, there's some places we'll name and say, oh, that university seems to have an easy way that connects everything. And if you go there, you'll get access to a lot of resources. And that's part of what enables people to say, well, there'll be innovations done where there's greater access. And I've been at IU now for 13 years. When I came here, I was fascinated to learn about all that a university like this had, but it was not easy to convey or for me to be able to see where everything is. And this had been a conversation that many people had been having about, oh, can we have little initiatives that try to bring, let's find out where these services related to research data are. And for everything from computing to storage to somebody who can help with data use agreements to navigating the legal system at IU to know whose signature is needed and what the ways of having different data security programs are for all the different types of data that we use. There's also so that's part of it is the consuming of data that others have produced. Then there's the producing of data. Many people's research produces data that can be used not just in their own work, but in others. And if there was a mechanism by which it was easier to manage others' access to it, then your work has more impact. And we know that that's being encouraged in NIH data plans and so on. So these conversations had been happening for a long time, but I think it was really, and I tell Darshan Shah of BioCrossroads that his creating the Book of Data and Organizations for Indiana is what brought this to the forefront, because we were thinking about how do we write down in that type of a resource for the state, what does IU have? Because there's so much, and yet even within IU, we don't know. So based on some of those conversations, then the Vice President for Research office said, maybe it's time for a task force to gather input. And so this task force has many members from throughout different areas of data, not just health, but health is well represented because Dr. Kuhn Huang, Dr. Sarah Weehy, Dr. Gerardo Malpame, and others were part of this task force that had as its task first go out and find what people want. So there were surveys, town halls about what do researchers feel that would make their lives easier. What have they heard other colleagues at other universities have? What do we need? That was researcher focused. It was also thinking about staff and organizations within the university, institutes, centers, units that are part of the landscape of data services. What is it that would make our lives easier? What would you like? Another aspect of the task force was to go and find out what are national movements in this area, what should we know is coming in the future, again, finding out what does NSF and NIH want to see universities have as infrastructure, and there have been reports that the American Association of AAU university-wide groups have put together reports saying universities should invest in the infrastructure for research data because things have changed, things change so dramatically, and that it is hard for any one unit to stay up to speed, but university-wide, and by universities being in associations, can find out what are the best practices and what should be done. And so we got to have go out and explore many other peer institutions and find out what are they doing in putting resources together. And so we found some commonalities. For example, in many universities, it was happening at thinking about the key areas to bring together were libraries, IT systems, and the research office. Thinking about these as three places that don't often get together and talk, but for creating research data infrastructure, that would be very necessary. So the task force then came up with a set of recommendations, which is linked in that news item, and said, we think this is not just a one and done, it's about building up slowly because we don't know what the needs are. That's one of the key aspects is we need to invest in finding out. And so once it's found out, let's provide some services and let's see if we're successful, we'll have way more demand than we have capacity for, and think also about creative funding settings for this. Where are there infrastructure grants? What can come in from central funding versus we build in? So that's what's in the report. And some of the first things that will happen now that this effort has gotten funded and announced officially is that we will start getting people who are involved in data services to sort of get together and think of what are the highest needs for what centralized infrastructure should provide, and to create something that will have a front door feel. So think about if first of all that coordination happens, that we find out connecting the dots, what sort of strengths do we have, who does what where, and make sure everybody's aware of what amazing resources they are, and then think, oh, but what will it take? What sort of additional resources are needed so that others outside of units could learn about, and where are there greater synergies? Once that's better understood, then it's how is that going to be portrayed? What will make it easier for any new faculty member, any new student, anybody we are recruiting, any person who is part of the staff infrastructure who's trying to get their work done, to feel like we can go and see what's there, right? Often people come and say, oh, could you tell me what sort of data does the university have? And I say, well, there is so much, but there isn't a place to point you to because there isn't one location you can go see it. So these are the things that we know library systems are really good at, and that we'll be starting a process of cataloging, just like we have for print and other resources. There'll be an attempt to get a very comprehensive data resources, but it's about way more than that, right? Building user communities, figuring out how we can, for new types of data that we want to, how do we do a really good collective, like figure which are the things that are the highest priority, and then we can take advantage of things like the new university-wide research equipment database new research equipment fund considers data as research equipment, but we'd have to make the case for why these are the priority items that really would benefit university-wide. So I'd love to discuss what questions you have and other things. Do
you want to walk up to the mic, Tom?
So this sounds so big, would be for members of the committee, the task to produce help with the understanding. Thank you. To help with the understanding, the comprehension, and the dissemination of this service. You know, but to be able to provide that for, you know, for students, for faculty, for postdocs in different schools, what can and cannot this data commons do for people? I mean, have examples that could work and that wouldn't work, so that the community has an understanding of what they can and can't use it for.
That's wonderful. Yes, and I should mention, it's just getting started. It's only yesterday that we are getting it started. So wonderful. That's such a good idea, because it could mean all sorts of things, and we have to, think about vignettes would be fantastic.
Could you talk about, this is for all IU, not just one campus, and kind of what that means?
Yes, so it's a really good aspect of a university system that at IU, in IT systems, UIT's Vice President for IT Services, were built with the idea that every IU school campus would be using some of the same centralized services. So that means also that when there are new ways that, for example, there'll be new forms of cloud computing that will be rolled out in the near future, it will be messaged as this is what's provided by infrastructure, and often a lot of it, is free. There will be some levels of, if you want additional services, there will be some fees that are charged, but it will be the messaging of it allows a lot of collaboration. That's what I have seen. Some other universities do not have, is that they will have a different system in one school or a different campus, which means that you can't get accounts or to be able to share. So this also means that team science is much more possible when all can have access to the same computing environment. It means you're more likely to bring in somebody who's, let's say, an undergraduate student into a research experience, because they're not going to cost you a whole lot to be added on as access. You can think about different things. So that's one thing. The other is the data use licensing legal structures, because when often data signatures are done at the legal office level, the signature is the trustees of Indiana University. That means automatically that it can be. There are some vendors of data that will try and say no per campus pricing, but I think it's more possible at a place like IU was saying, but the signatory is the university, therefore it makes sense for it to be for access to all.
Go ahead.
Yes, very good question. So we'll get started right away. We've already scheduled some meetings that are of getting key organizations like IT, libraries, and there's also been many meetings that have been happening leading up to an expectation that this will happen, that this announcement will happen. But we should also think about this as a one-year time frame in some regards of let's build out and try and see and assess people's needs, but have a chance to do like refiguring, is this right? Is this going on? Partly, one thing we have to be aware of is that the new vice president for research role is about to transition. And so we can't, we aren't given a, here it is for 10 years, you're guaranteed this is what the support level will be. It's sort of a, let's start it now and let's wait until when the new vice president comes and gets to do a more comprehensive assessment. So that's why I'm thinking that first will be this 1 year, but knowing that it's not that it'll be a one and done, it's what are the stages of what we should aim for in the next 5 years. But I can certainly talk about what are the things that are planned for the first year.
When people have people coming to use these data will often not come and saying, I know what data you have, and I know what I want to answer my question. They'll say, I have a question.
Yes.
And
exactly.
what data do you have to answer my question? And how do I get them into an analyzable data set so I can analyze them? And you can, I guess we could expect everybody to have people that would have that capability of accessing those data as a distributed resource, or if there could be a central resource of people who know how to access these data and will facilitate the access. But even stepping back from that, sometimes you need help even how to ask the question. You know, when we established the data core here, when people came and asked for data, they didn't know what data we had, they didn't know what data they need, and they didn't even know how to ask the question they were asking. So we had to kind of work through that process. So I worry that without that kind of translational service, you've got a big resource that people can't dip their hands into because they don't know how to do it. And the other kind of related question is that data in the discharge case abstract data sets are all coded, everybody knows how they're created, et cetera. But clinical data are also data. You know, clinical text notes are data, and there's a lot of information in those that aren't coded. So what kind of resources will there be available to take advantage of these things, or will we be stuck having to, you know, kind of work in the same sandbox of, you know, ICD-10 codes of discharge diagnoses, et cetera?
Yes, all really important questions. I'll say this is, we heard when we were doing the task force work of looking at how all different universities have been addressing these questions, all came up too. And I'd say that this view of how we can think about data infrastructure is completely holistic. It is not just about what do we own and let's just write down what's there and that somebody would know the acronyms and be able to find them, right? There are a few people who will come in saying, oh, I have used this data set at this other university I'm at. Do you have this? That addresses that need. They know exactly what to do. Somebody might come in saying, oh, is there Nielsen scanner data? And we say, yes, IU owns that, has a license, and here's how you use it, and that's that. But so much is around asking, how do we integrate research data availability into people, like the scientific discovery process or the learning process, where I'm just trying to set out to answer a question. I don't care about the data at first. That's not what drives my question. I have a fundamental need. Society has a need to be met. We want to address that. And then it's by understanding, oh, we need to do this. There's a question that needs to be asked. What's an appropriate way to ask it? Some of it is primary data collection. Some of it is deep ethnographic research. Some of it is saying, I can also address it by this resource that has these data. So where should that occur? Let's think about, again, if there are many people who play these navigator roles, right? Some of those are in libraries. We have people, even if it wasn't research data of the type we're thinking about, like claims data or clinical notes, we would have gone in a university to somebody who comes and maybe visits my class and say, oh, class projects are happening, let us guide you to the resources. So this is about having those navigators have an easier time knowing what those resources are and to have a deeper knowledge of the strengths and challenges of each, of how to connect, of how to compute. Where do you go next? Not just, oh, I've heard there's this resource, but I really can connect you with somebody who can give you a really good assessment. So it's also about those navigators knowing the human connections. Who is it that's the best resource for something that's there? And the point about some of these data are data not yet actualized. It's an excellent one, especially when you think about the type of data that are in arts and humanities, for example, paintings, music. These are data forms that can be studied. They're not yet all translated into data versions, but there are advances that are finding almost like OMUP models of how do you code music data, how do you code art data. People are innovating. And so that is definitely part of this process, is how do we create data out of things? And that's also part of producing data. How do we then help researchers make their findings into something others can use? How do we make sure that all of the steps of privacy and confidentiality are handled by not just the onus isn't just put on the researcher, that there are groups. Like within UITS, there's a group called Secure My Research Data, right? That helps with drawing up data security plans. That's something it's not easily known, but that's the kind of information that would be these data services. Hope that answers the question.
As Monica walks up to the mic, are there any questions that came online in chat? We'll check with that.
My question is just because it sounds like this is going to be a really powerful resource, readily available to the research and academic communities in IU in the system. Are there also any plans for making these data or making this system available to the community, like through grant services and things like that? Like we have the, we can do here at Regenstrief, you can do free feasibility counts. So are we going to put those in place to make it more accessible to community groups as well?
Yes, definitely. So you should think about this as we are only as useful as the use cases we can find that are outside. Like all our work is driven by needs that are not just within a university. And so one way to think about this is that by the nature of some of these services, for example, a data use license might be written very strictly that you have to be an IU employee or an IU student to use it. These are not things within our control. But what's within our control is how much we collaborate. So if people who have a need are looking to us to help partner and fulfill that need, we then bring more tools to the table and we can be more impactful for fulfilling that need. That's one thing. The other is that there are lots of training opportunities that are created that are open to anyone. And there are also many of these dots we're connecting are places that anyway serve the public. So think about IU's social media data observatory. It's called the OSOME Lab, OSOME. Right? There are lots of services that are produced through that organization that are entirely outward facing. And so this would be to, again, let it be wider known that IU has these resources, both more for internal and external use. I'll mention one other resource that is coming online next year is the Federal Statistical Data Center. So the federal agencies have a way for researchers to get access to geocoded data from CDC, the National Center for Health Statistics, from the Bureau of Labor Statistics, from the Census Bureau. Many federal agencies will have only this as the method to get access to identifiable data. Often a lot of these data are linked. So there's a version, for example, that of Medicare data claims that is being linked to death records that will only be accessible through a source like this. Or there's already many IRS tax data linked to household individuals and job. Those are types of data that researchers can only use through a federal research statistical center. And so IU is getting one of these, and the building has already started. It will be open starting next year. And so you'll be able to, for free within IU, of course, I don't control the pricing of all this, so I don't know exactly what I think the intention is to have it be free, to have projects brought already online. We currently have access to the Kentucky one. So now this will be that Indiana will have one of its own. It's really important to have it be geographically close because you have to actually go in person, get fingerprint, you get access through biometric ways because of all the security. So you have to have FBI clearance ahead of time. Your project has to be vetted by these agencies as there is a need for identifiable data, but there's just increases the scope of the kinds of things that can be studied.
If someone has data they hope will be in the commons or has questions about it, or if they want to, like, is there a place that you have a dashboard or something so they know where it's at and what's coming? Or
very soon, those are the first meetings that are happening, are exactly what are we going, where it's going to be. I'm happy to serve as a point person for any questions you might have, and we are planning to have regular updates we make through the research communications emails that go out that say what stages or how can people engage. But what we will have very soon, we're aiming as one of the first things, is let's think about some 10 most easy to engage with, most of demand types of data resources, and let's create a little front door experience for those. We are hoping that we could feature things that are happening at Regenstrief too as one of these, and to be able to just say, not that we would open the floodgates and everybody would rush, and just how do we go around messaging? If your research involves these kind of questions or you're interested, here are some examples. So we could think of so I'll mention a resource that we're hoping to have in this way soon that has started. I can point to a website where we've got some of this already. So there is a system by which states, hospital discharge records, emergency departments separate from inpatient and outpatient surgery are collected and transmitted to the Agency for Healthcare Research and Quality into a project called HCUP, Healthcare Cost and Utilization Project. So we know that if there is once a purchase of this by a university member, it can be used free, reused for anybody else at the university. So we're trying to set that up. We have purchased Indiana's records for the last several years. There's also a 20% of national data. The steps of receiving it require some, Josh Vest sitting right there has been the original inspiration for these projects that you have had funded that brought these kind of data to you. We've learned how to use them and how to onboard other people onto it. And so now we want to have, not that each researcher who innovates this way then has to take on the work of how to onboard other people. Can this become a service that the university research data stewards can provide? That's an example of scaling it up, because then it's one of many things you know where to turn to and say, oh, this doesn't fit my need, but there's this other thing, and then talk me through, and it could be part of then what libraries knows, oh, this is how we connect, so we point you to it. And this is a way any one of these licenses, could be used by vast numbers of people. And it makes it then easier for anyone else to use it, because you say, I want to solve this problem, and then you discover within it somebody else has had to deal with, how do I code this disease? What's the right set of ICD codes to be using? So that's what we are hoping in the short run to have, is like 10 of these kinds of resources that we can point to as here's a front door field of this.
Do we know yet what our Regenstrief, so you said you'd like us to be part of that front door experience. Do we know yet, like, what's, we're talking about it?
So I think this is the way in which this is a conversation that we start, right? I don't know what these 10 should be, because it depends on who wants to, who feels that, because it's not just an imposing, oh, we picked this and you're now going to be showcased. It's, can we just see who would like to take advantage of these initial resources to make those data that they already are? Somebody else is the champion for these. We are not, right? So it would be to go to researchers and say, seems like you've had a lot of experience with these data. We have started to establish now this as a university will support. An example, again, is the Optum Cliniformatics database, right? It started as something that like 1 or 2 researchers many years ago had a license for at IU. Some people then got more familiar with it because they were collaborating and adding more people to their data use agreement, but it's probably like 5 or 6 people who were using it. Then an opportunity came when there was a retention package the university was negotiating for some researcher that included a data purchase. And then that license got to be rehashed and we learned that it could be made university-wide. So then it was, oh, now this becomes something that not just that researcher gets the support, we started to get resources from UITS and elsewhere to support the onboarding of more people onto it. And so it has already become one of those which there's university services around. So in that same way, we're thinking, where else is there an opportunity? Who else? And that's why I want to make this an invitation. Would Regenstrief like to be one of those resources highlighted? What are the ways in which we can make more people more aware? And then what are the services that can be taken on elsewhere, or what needs to happen? And some it's just researchers getting together and voluntarily contributing to user resources. And that's part of what's happened through the Optum Cliniformatics database is many people are willing to share code of here's how I did this, or an example of how I wrote the data sharing plan. Thank you for some in the audience who have helped me with that. Right.
Hi, Kosali. Great to hear that kind of discussion. I think we'd be very interested in collaborating with you around some of the possibilities on the data side. But is it fair to say, just listening to everything you've been saying, to clarify for folks, in case they're thinking the data commons is a technical physical database, it's not.
Yes,
it's
not
social,
a data lake. It's not a
social connectivity.
Social
it's
connectivity.
how to amplify access and penetration of these.
Absolutely. So
okay.
This is good. Tom, getting back to your point about what to make clear it is not. Some people hear this idea of a data commons and think, is this going to be one big login to everything? And that is not what it is going to be. Or is this an attempt to try individually link all our data so that we find the same people in this survey and same people? That's not what it is. It is simply infrastructure that connects the dots about what's already existing and then says, you know, oh, we have discovered some researchers have a database that they have bought a license to that they would like to extend the collaboration, because I think we're all driven by, oh, I have learned about this data source, but actually I'll get more out of it if others join me in exploring it and enriching it. And so what can then be services that libraries take on or says, okay, we need to build some infrastructure around this. Here are some templates we have come up with. Those sort of things.
Other questions? You've just been given an invitation. And you're awfully quiet. Did you?
I wanted to ask you about something else related to what you do. Away from this.
Sure, yes, yeah. Love to talk also about other things happening in Bloomington Health Sciences. Or
I personally, I'm bothered by the fact that in medicine, we're not looking at cost effectiveness. That under the Affordable Care Act, we as researchers and as healthcare consumers have been told we will not look at cost effectiveness. I think it's extremely wimpy that we're not doing it. Where things are costing so much, where the cost of healthcare is approaching 20% of the GDP. And if you tell me that you don't think it's important for us to look at cost effectiveness, I'll stop feeling this way. But I'm hoping that you will. And I wonder if there is some plan, or if you have heard anything about this posture changing in healthcare, because it seems like it's due to come back the way things cycle in medicine. We have ignored it now since the Affordable Care Act has been approved.
Since those panels.
So I just wonder what your thoughts are about this, because we're always thinking cost effectiveness, but then we say, well, no, because we're not supposed to look at it.
I'm going to point to the political process as where these answers lie, right? So I think we can all agree that taking account of how cost effectiveness one type of medicine is versus another is important for society. But then when we say, okay, and then we want it to be legislated as one of the ways through which decisions will be made about what's covered, that becomes really difficult to get support politically. So I think of what happened under the Affordable Care Act in cost effectiveness as demonstrating that.
I want to follow up on Tom's question, because when we think of things that are not cost effective, we think of things that don't work but cost money. things like pre-admission testing for surgery, you know, proven for 20, 30 years that it has no value, and yet it's done for most surgical procedures now. So, but that's the easy one. You know, we talk about valued care, it's effectiveness over cost, right? And if the effectiveness is low, then even a little cost is hard to justify, right? The hard thing is if the things that actually work and work well but are horrendously expensive. Hepatitis C treatment. You know? It works, and it works really well. Unfortunately, the people who are at risk for that don't have insurance. So who pays for it? How much can you pay for it? Can you afford to have Medicaid pay for all to treat everybody with hepatitis C, which we should be doing, but then we don't have any money to vaccinate kids. So making those tough decisions, you know, I agree that they're policy decisions, but the health economics has to provide the evidence upon which people make hard decisions. I'll give you another example. Some people in the room know that I'm being treated with immunotherapy for malignant melanoma. It's gonna cost more than $500,000 for my year of treatment for this stuff. And I look at that and say, is that cost effective? But on the physician side, I don't care, because the guidelines for treatment are, if you have this other disease and you have this functionality, this life expectancy, then you're going to get treated. But if you magnify that times the number of different cancers that are being treated with these things now, it'll bankrupt us. So either we have to get the cost down, or we have to find some way of making the tough decisions. And how do we make that without the right kind of, not just data, but analyses?
Yes, I completely agree. This question is going to just keep getting more important as we think about what are new drugs in the pipeline and the amazing effectiveness of the medications that are being investigated and the expected price tags. And what hard decisions programs like Medicaid will have to make about what's covered, who's paying, what are the conditions under which we say any innovation is an innovation we want to have benefit our population. I think these are, so now I'll get to what is it that, I'm going to say, well, so much of it is around understanding the support politically that's driving these forces of who's going to pay for what. But what can we do to produce better evidence? So one area is thinking about how to categorize costs and benefits. Like, what are the things we want to monetize? When we think about cost effectiveness studies, we think, oh, look how successful it is. We've thought about measuring longevity or the quality adjusted life years that are produced, but there's a whole lot to thinking about how to value society's value of those things, how to think about externalities, and so better ways of conducting studies, how to get more of the long run in and think about alternatives. So I don't have a whole lot more to say than that it's going to be a big issue, and we're going to watch many fights happen over new medications that are coming out, and where will advisory panels draw the line, where will private funders. Good. Absolutely. Yep, totally understand. Mm-hmm.
But the medical community is being swayed away from using
Yep, absolutely.
I know we have a few minutes left, and you have some handouts that you wanted to share, some services.
I want to mention a few things that are in the vein of thinking about trainings or ways of research mentoring that could be made large scale. So I want to mention a few things that some groups at Bloomington have been creating that are meant university-wide. I also want to mention a few things of new developments on the Bloomington campus that I know some are extremely aware of, but I don't know if, again, even in Bloomington, I'm aware of a few things that are happening. So one is that we have had the move of the hospital in Bloomington to be rebuilt on campus because it was a renovation and a move that was going to happen, and it was decided that the area that was the golf course will be where the new hospital is, and that's been over a year now since the move happened. And so that makes that we have this regional academic health center feel, the South Central region, and that's a lot of educational programs are happening, new simulation labs, and it's very exciting, new residency programs in the plans. So it's really increasing the feel of us trying to take advantage of having a hospital located very close by. Another is that there's been a tremendous growth in health sciences programs. Particularly, there's been a lot of growth in the School of Public Health in Bloomington. And so some of the highlights to talk about in terms of collaboration is that there are many new faculty that have arrived that are just getting settled into campus. And one of the first questions they have is, we know about all of what medical school, public health, Regenstrief, Indianapolis has. How do we get connected? So numbers wise, just in this past year, so people who came in 2022, 25 new tenure track faculty members in the School of Public Health. Next year, so hiring that's happening now, anticipated there'll be 15 new faculty members coming in. And so they've also started a PhD in biostats, a new PhD in nutrition, and it's also been incredibly successful growth in terms of diversity of the program. The School of Public Health has over 1/3 of its faculty are in underrepresented racial and ethnic minority categories, and they've received a HRSA grant recently for increasing funding of graduate education for scholars of minoritized backgrounds. So many things where I think the campus, it's feeling like there are lots of people who want to try and find paths to connect, and so I would love to learn about more ways again, or just to say that there'll be many people in Bloomington looking for collaborations.
Great, thank you. I think we're just at time. Did you finish?
I forgot to mention what the handouts are. So a couple of programs are about hybrid modules of, if you have team members who like to onboard onto professional topics of research development, everything from data visualization training to research communication training to workflow reproducibility training. We've got some modules, well, I'll describe, that are just like click here and you get signed up, and there are hybrid modules of networking events as well. And within it is also a resource that is a collaboration between the School of Medicine, Graduate School for the university, and many others to fund more training opportunities through what's called Nature Masterclasses. If you haven't heard of this, IU now has a license to this, which is like essentially right now it's 14 different topics in everything from grant writing to publishing to navigating research careers that are, I have lots of handouts of those things there.
So thank you so much for spending your afternoon with us, and we really appreciate it. And please join me in thanking Dr. Simon.
Thank you very much.
If you're interested in getting a handout, and there's not one up here or you're online, Beth has the original. So if you contact Beth Sullivan, she'll be able to scan them and email them to you. Thank you.